Hi, my name is Dr. Arturo Bonilla. I am a pediatric microtia surgeon here in the United States in San Antonio, Texas. I'm going to be starting a series of video lectures on certain parts of microtia and atresia. Instead of giving a really long presentation, I'm going to start giving little kind of a mini series of lectures. And the one I'm going to give today is specifically on hearing. There's a lot of questions, a lot of things about why did this happen to my child, things like that. Well, today I'm going to focus just on hearing component, and we can certainly get into a lot more detail with other video lectures. But for right now, I'm going to keep it relatively basic, just to get through some basic questions that parents have. I recently got an email that said, "Doctor, my baby was born with a microtia without an ear. I don't know what to do. What am I supposed to, is my child deaf? What's going to happen? So who am I supposed to see because of this?" So I thought this was a perfect segue to begin this kind of video series. And this will be the first one on hearing. Well, number one, it's really important to stress, don't worry. Things are all going to be okay. Once we get through all this, you'll understand that actually it's relatively a basic management that we take to help these kids. So who am I supposed to see? Well, there are really a lot of important doctors, but really the main ones that we see, of course, the pediatrician is really important. The pediatrician can refer patients out to the ENT doctor, to the microtia surgeon, to the geneticist. So that's really a key component. Of course, geneticists is important. They can go through family history. They can help you with things like that to find out if there's any correlation between what happened to your child and other people in your family. An ENT doctor or otolaryngologist is really crucial. They have to be looking at the ears, and they usually have audiologists within their office where they have a hearing booth, an audio booth, and they can take hearing tests and things like that. So that's a really important component of the management of microtia. And finally, the ear reconstructive surgeon, the microtia surgeon. Personally, I like to get involved in these kids' lives from the day of birth. I think it's so important to be able to talk to the families and let them know that everything is going to be okay. So let's start. I'm going to go through a basic anatomy lesson of the ear, and I like to kind of divide things up into three sections: the external ear, the middle ear, and the internal ear. And it's really important not to confuse this, because when somebody says, "Oh, everything in my child's inside the ear is perfectly normal," well, that's not necessarily the case, and I'll explain what I mean by that. So let's start with the outer ear. The outer ear is composed of the outside part of the ear that you see, including the ear canal all the way until you hit the eardrum. All that's considered outer ear. Now, on the other side of that eardrum is the middle ear. And in that middle ear, there's three little middle ear bones. They're called ossicles. The last bone is called the stapes. It's actually the smallest bone in our body. And I want to show you how small this is in comparing it right here to a US penny. That's how teeny these little bones are. Now, it's really important to know that the outer ear and the middle ear form at the same time. And so when something happens to the outer ear, such as microtia, an ear deformity like a microtia, almost always the middle ear structures are also malformed. So when somebody says, "No, I heard everything was perfectly normal inside," well, again, it's all semantics. We really need to know what they mean by inside. So again, the outer ear and middle ear form at the same time. So what happens is when you have a child has a microtia, that means that the middle ear bones most of the time are also malformed, or they're fused. So there is an abnormality of that middle ear. So now let's go back again with the anatomy. Outer ear is the part that you see on the outside all the way to the eardrum. The other side of the eardrum is the middle ear, the three middle ear bones. Now the internal ear, the inner ear, that's the most important part out of all of this. There are two organs in that inner ear. One is the balance mechanism, and one is the hearing mechanism, the hearing organ, or the cochlea. It looks like a little snail. Now, it's excellent news for all of us that the inner ear forms at a totally separate time as the outer or the middle ear. And because of that reason, the inner ear, where the hearing nerve is almost always normal in these children. So it doesn't matter that your child has a microtia, that there is no outer ear, no ear canal, middle ear bones are fused. Doesn't matter. The inner ear is almost always normal, and that's really good news for all of us, because we just need to figure out how do we get sound from the outer environment into that inner ear, and we'll talk about that in a few minutes. So here is just a little video of how sound works. As you can see, the sound waves come from the outside. They go through that funnel, which is the ear and the ear canal, and they hit the eardrum. That eardrum vibrates, and that vibration of that eardrum causes the 3 middle ear bones to vibrate as well. And that last bone, the stapes, moves in and out like the piston of a car into the inner ear where there's fluid. And in that fluid causes a little wave, and that causes a little electrical stimulation of the hearing nerve that goes straight to our brain. Now it tells our brain that we're hearing sound. So that's how sound works. I wanted to show you just a couple little videos of these some kids where they've heard sound clear really for the first time. This little boy had a microtia on the right side, and you can see how I put a little auditory processor that just vibrates on the right side of his head, and you can see how he responds the second that touches his head. So you see he's really getting excited about this because he's hearing sound he's never heard before. So it's a little bit different. Here's another video that I just love, one of my favorite videos ever. This is of a little 6-month-old boy. Same thing. He's never heard really clear sound on his right side. So I put that same little auditory processor that vibrates onto that right side, and look at his response the second he notes that he hears sound differently.
Got loud all of a sudden, didn't it, huh? What do you think about that, huh?
I think you like it. I think you like it.
Isn't that amazing? I love to see that video. So he knows he's hearing something, doesn't know probably what it is, but it's totally different. He's never experienced that in his 6 months of his young life. So let's go through just some hearing options. There are basically 4 options. One option is to do nothing. The second option is to put a soft band, which means a little band that has a little processor like a Baja. From different companies, could be Cochlear, could be Oticon, could be Contact Mini. The third option is the Baja implant system, which is actually a surgical option. You actually implant a little implant into the skull, and that connects to a little post, and we can kind of hook on the auditory processor or the Baja onto that. And then the final option is the ear canal surgery, or Atresia plasty, or canalplasty, how some people call it. Before we do all that, there's still certain things that we have to have, and these are the hearing tests. There's 2 kinds of hearing tests in general. You'll hear about this, well, you probably have already heard about this. The first one is called the ABR, or the BEAR, and that one is specialized for the real small little kids, right, the newborns. And the reasons that we have that, the children, they're just too small to say, I can hear on my right ear, I can hear out of my left ear. They just can't, they're too small to do that. So we actually have to rely on computers and electrical impulses that their brain sends to us, to the computer. So an ABR, basically, here is a little diagram, just a whole bunch of squiggly lines. We don't really have to go too much into that detail. I'll do that in another video lecture. But basically, the kids are the first 6 months of life. This is what we rely on to make sure that that inner ear works. We know that the outer ear is not there, that the ear canal most time is not there as well. So they do have some hearing loss because of that reason. But we want to make sure that the inner ear on that side works perfectly normal, and it almost always does in these children with microtia. So when somebody says, is my child deaf? No, they're not deaf. The inner ear works perfectly. They do have severe hearing loss, but they're not deaf. Now the second hearing test, which is a really important one, once they reach about 4 to 5 years of age, then we can get this in an ENT or your otolaryngologist office or your audiologist office, where they actually put them in a soundproof booth and they do a formal hearing test, and that's called an audiogram. So now there's a whole bunch of ways to go about this, and I'm going to go just a very simple lesson about how these audiograms work. This is a basic audiogram here, a basic hearing test, and a whole bunch of lines up and down. And what you see on that left side, those are measured by decibels. That's how loud they have to crank it up for your little baby to hear. And the vertical lines, those are the frequencies. That's a different kind of frequencies that they test. And if on a high frequency there's a hearing loss, that means that they really have to crank it up decibel-wise. I'll show you what this looks like. So a normal exam, of course, you'd want it to look like this, almost at that 0 level, really between 0 and 10, 0 and 12, 13, around there. That's what a normal hearing test looks like. On your child with a microtia, this is what it looks like. This is a bilateral microtia. Just as an example, you can see that they have moderate to severe hearing loss. Well, that part that's highlighted in the yellow, we want that to move all the way up to this part of it right there, to the normal hearing. That's what we try to do to fix the hearing, whether it's through Bajas, through ear canal surgeries, through soft bands, anything you can think of. That's our goal, is to try to get sound all the way up to that level. So let's go back as far as the 4 hearing options. So one option is to do nothing. In children that have unilateral microtia, just one-sided microtia, we don't necessarily have to do anything. They have the normal side that they can listen, they can hear. Personally, I like for them to be aided anyway. In other words, to be using a soft band so that we can stimulate the microtia side also. But the different philosophies from different otologists as far as how quickly we have to go in there and use hearing tests or to aid them when they're only affected on one side because the ear works. Now the second, the other thing to think about is the bilateral. Now children with bilateral microtia and atresia, atresia means no ear canal, those kids have to have something because they don't have any ears, they have the microtias, they don't have any ear canals. So what they feel like is just muffled. They're not deaf. Remember that inner ear works normally almost on everybody, even though they don't have those outer ears. So we have to figure out how do we get sound from the outside into that inner ear. So for these kids, when they're born, soft bands are absolutely necessary to aid them from the very beginning. Okay, so let's go to the second option. Second option is a soft band. And basically a soft band is just a band that goes around the head, and you put this little processor that vibrates. So when sound strikes that processor, it just vibrates, and that's pretty much it. So if you want to find out, let's say that your child has a right-sided microtia. What does my child feel? Well, it's real easy. Stick your right finger in your right ear canal as tight as you can, and that is your child 24/7. Well, you know, that means you're not deaf because your ear is inside the ear canal, but sound can't get through because it's being occluded by your ear. Same thing with your child, except your child does not have an ear canal. So it's just like having an ear 24/7 in the canal. So the inner ears work both on us as well as on your child almost always. So that's what your child feels like. They're not deaf, they just have some muffled sounds. Now the soft bands are different brands, of course. There's Cochlear, the Baja, the Oticon, the Ponto Pro, BHM Tech, you have the Contact Mini. The third option is ear canal surgery. Before we do any of that stuff, remember we still have to get hearing tests on everybody, but also it's important, it's essential to get a CAT scan, a CT scan of the ears. They want to look at the outer, the middle, and the inner ear. And as you can see here on this CT scan, on the right side there, you can see that there is actually an ear canal. And you can see by the arrow there that air is black on a CAT scan, so you can see that there is definitely a canal. On the other one, on this one, there's no ear canal. So this child has an atresia. Now the inner ears are normal on both sides. So we just have to figure out how do we get sound from outside to that inner ear. So when you're trying to figure out, is my child a candidate for ear canal surgery? Well, there is a general classification called the Jarsdorfer classification, the J scale. And it's basically from a 1 to a 10. And now the neurotologists examine the CAT scans, and depending on the anatomy, they give it that classification from a 1 to a 10. Just the fact that they have a microtia knocks them down 1 point. So basically a 1 to a 9. If they're considered less than 5, then usually they're not candidates to have the ear canal surgery. 5 to 7, now they have better options. Maybe not of achieving perfectly normal hearing, but better hearing. When they're an 8 to 9, they have an excellent chance of having close to normal hearing, or if not normal hearing, in the speech frequencies. Now for the ear canal surgeries, or the outer ear surgeries, for the surgeons that perform cartilage, the cartilage technique, we have to go first. We want fresh virgin skin on that side. We don't want any scars, so we have to go first. Once we finish our part, then we hand the kids over to the neurotologist if they are indeed candidates to have the ear canal surgery, depending on the patient, the parents, if they want that or not. So we always go first. So in general, the ear canal surgery is really not done anytime before they're at least 5 or 6 years of age. Sometimes a little bit older. Some start sooner. Again, for ear canal surgeons who use the surgeons that perform the cartilage techniques, such as myself, we go first and then they go second. So the final option is, again, the Baja implant. Let's say that the child is not a candidate to have the ear canal opened. In that case, then we have to figure out, well, how do we help these children hearing on that side? Once again, if it's just on one side, they can go through life without any aid at all because they have the normal side. If it's on both sides, we have to help them. So again, one of the options, of course, is the Baja implant, where you basically screw a little implant onto the skull, and then you attach an abutment or a post that sticks out of the skin, and then you click on the processor that just vibrates, and that vibration goes from the outside with sound, goes straight to that implant all the way into the inner ear, the internal ear. Now there are the newer kind of implants that Cochlear put out, which is actually a magnet. Now you don't have a post that sticks out. Now the magnet's inside, and the outer processor is attached to the inner magnet by a magnet itself that's connected to it. So I am a huge advocate of music. These kids have a huge advantage that other children don't have. If you notice, if you hum really loud and then all of a sudden you occlude it, you cover up the ear, you notice that the sound, it becomes much louder on that side that you occluded. Well, that's what these kids with microtia have 24/7. So if you can imagine, what if they're playing the instrument, they're playing the saxophone, anything that causes vibration goes straight to the microtic ear, and they can hear sound better than other kids, in essence, where they have all the environmental noises that they have to kind of cancel out. So as you can see here, of course, many people know who this is, Paul Stanley from the band Kiss. He's their lead guitarist. He was born with a right-sided microtia and Atresia. And he did nothing until he was around 30 years of age. So he basically did perfectly fine, very successful, very musically inclined, very talented, with just that left ear as the main hearing ear. So I'm a big advocate of music, music, music. I want to give a shout out to another musician who I've been in contact with from the UK, Nick John Wilson, and I put his website up here so that we can support him. He was born with a left-sided microtia and Atresia. He has not had it repaired, and he went through the typical adolescence that these children go through, and he's on the other side now, and he's doing extremely well, writes very inspirational music. Love to hear his music. Really very great guitarist, very talented. And I love his little quote that no matter what obstacles you face, you can always achieve your goals and dreams. If it's something you want to do, do it. It can be done. I love this. So if you have a chance, check him out and support his music. Now we're going to go to a little bit younger. This is one of my patients who's extremely talented in the saxophone. He had his right ear reconstructed. I reconstructed his right microtia and Atresia. Did extremely well in high school, into college with playing the saxophone. Very talented. And here's another child from Guatemala. I think he's like a maybe 10, 11-year-old who loves to sing. He actually travels through his country singing in his church group. And very, very talented singer. As a matter of fact, he's one of the child prodigies in soccer in Guatemala, which is in Central America. Here's another little girl from Cyprus, one of my patients. She's about a 9-year-old, loves to play guitar, loves to sing. She sent me this great video. Just really talented, really sweet little girl. Here's another patient of mine from Bulgaria. He's already out in the studio singing away, so extremely talented. So that's what I mean. These kids are very, very talented. They have something that other kids don't have. And it's really important to get them involved in music, because they can really excel in music and as well as in life. So let's talk about what not to do. Now, it's really important to avoid really, really loud sounds, especially in children who have just one-sided microtia. We really need to protect the good ear, the normal side. If there is a question of ear infections, take them to the pediatrician as often as you need to make sure that they can hear as well as they can on the normal side. And then a lot of common sense. Of course, you don't want to do this. You don't want to be standing by a jackhammer, obviously. Or another thing you don't want to do, you may not want to be walking next to a jet engine. Not the best idea. Just common sense stuff. But all kidding aside, it's really important to keep in close contact with the pediatrician, your ENT, your microtia specialist, early on. That way you always have a plan and you know exactly what to do. And I'm not a believer in somebody saying, okay, well, you're 1-year-old, I won't see your child for another 5, 6 years. No, I like to see them all the time. Or if anything, if you're from out of town or out of the country, I like to maintain communication every 6 months to a year, or as much as you want. Now, a child with bilateral microtia, similar precautions. Of course, you want to avoid extremely loud noises. Not as important as these kids, because remember, they have muffled sound on both sides. Now, if they have soft bands, they can hear much better. But again, same typical precautions. But what I really say about all these kids, regardless whether they have unilateral, bilateral microtia, just enjoy life like any other child. So in conclusion, don't worry. Things are going to be just fine. Everything is going to be okay. And always seek information and stay up to date as new technology emerges. It's really important to always find out what's going on, what's new, what's out there. There are a lot of exciting things in cartilage tissue engineering. So a lot of really neat things are out there, a lot of neat things in technology as far as even for hearing. So if you ever need to contact me, here's my phone number. My website's microtia.net. This is all I do. I love to talk to families. If you have any questions, feel free to call me. As these questions come in, I'll start setting a little a video mini-series basically, and I'll get more into detail as far as all these other little things. That way I won't get too much into detail, but just enough where people can understand and comprehend how we manage these kids with microtia. So if you want to get a hold of me, go to my website, microtia.net. We keep a lot of up-to-date stuff on our Facebook page, so you want to just click on my page and then click on the Facebook icon there, and that'll get you to my Microtia Facebook page. So again, really want to thank you for listening. Keep the questions coming. I love to talk to people, and I'll keep this series going as long as you guys want me to. So feel free to call me anytime. And until next time, enjoy and live life well. Take care.